2026 Medicare plan cuts are coming, and you could be losing these 5 benefits. Now, open enrollment ends December 7th, and there's a lot of major changes coming in 2026 for those older plans. So, to begin with, let's talk about the 5 things that are going to change that are going to really hurt you if you haven't looked at any of the new plans and are just hanging on to your older plan. And not to make everything just doom and gloom, we'll also go over a few ways that you can actually win going into 2026 as long as you beat the deadline. Before we jump into these cuts, make sure you hit like, subscribe, and comment below. It really helps out the channel and helps get this information out to those that really need it, whether it's the seniors, the caregivers, or the families who otherwise wouldn't get this information until it's too late. Remember, the December 7th deadline is right around the corner, so we really want to make sure that we get this out to as many people that need it as possible. So let's talk about danger number 1, and that's the changes in the provider network. What we're seeing a lot of right now is that a lot of doctors, hospitals, medical centers are leaving the network for older plans, but still remaining in the network for the newer plan. So you could be with the same carrier, lose your doctor on your current plan, and all you really need to do is switch to one of the newer plans that are in the area. So number 2 is going to hit a lot of people pretty hard, especially if you need dental work or need vision coverage. So if you do need dental and vision coverage and you had it on the older plan and you need major work and things like that done, it's going to really hit you because the annual maximums are getting cut. How many visits you get per year are being cut. And really what's happening in some cases is they're getting rid of comprehensive dental altogether. So you might go from seeing $3,000 of coverage for the year drop down to $1,000, and for some older plans, dental and vision is being removed completely. Which brings us to number 3, reduced over-the-counter groceries and flex cards. So with a lot of the older plans, what we saw was really robust coverage here. In fact, I had a client that was getting somewhere between $60 and $80 a month on her plan for 2025, and in 2026 it was dropping down to about $15 per month. So huge jumps in that, and there are ways to increase that coverage, but again, we'll get to that later on in the video. Which brings us to number 4, which is higher out-of-pocket costs. Now, for a lot of you, you may not go to the doctor very often, may not go to the hospital very often, but at some point you're going to have to, right? And the danger with these older plans is what we're seeing over time is that the annual out-of-pocket maximums are going up, the co-pays are going up for the doctors and the specialists, and lab work, inpatient hospital stays, all of those co-pays are rising dramatically. And we're seeing that from year to year, but from 2025 to 2026 is some of the biggest I've ever seen. And the last one, number 5, is going to be worse drug coverage. Now with this, it's not across the board, but we are seeing this with some of the older plans where they're not covering some of the higher end prescriptions that they used to. It is still possible to get those covered, but now you have to jump through hoops to get them covered. Those are the 5 biggest changes that I'm seeing with these older plans for 2026. And those are the things that you're going to want to watch out for. Now, after hearing all that, you may be thinking, why is this happening? Why are they doing this year after year? Well, it's actually a real sneaky strategy that the insurance companies use. All of them use this. And what they do is they're counting on you not to check. So what happens is they want to attract new people onto their plan, right? So you would think, why are they raising the annual out-of-pocket maximums? Why are they raising the co-pays and things like that? The reason for that is because they introduce new plans every few years that have the lower co-pays, that have the lower out-of-pocket maximums, that have the enhanced coverages for over-the-counter and things like that. But what they're counting on is for you not to check that so that they don't have to pay those benefits out to you because you're not looking after your plan. What happens is they attract the new people and they get to take advantage of those benefits. So you can kind of look at it like this. They reward those that actively look at their plans and are making sure that they're on the best plan for them. And they penalize those that don't because it works out better for them. So that being said, what are some ways that you can actually win going into 2026? So the simple answer is check your plan from year to year. Get with a broker that's going to help you look at the plan side by side. Let's talk about some of the wins going into 2026 with some of the newer plans. The first one is going to be enhanced dental and vision coverage. So just like the opposite of what was happening with the older plans, we're seeing much higher annual maximums with these newer plans. So the other thing that we're seeing are upgrades to the flex cards. So not only are there larger amounts on the newer plans, but we're also seeing more categories, more things that you can buy on the newer plan. So where they're reducing things on the older plans, they're enhancing them on the newer plans. The third thing that we're seeing is actually lower costs for the prescription medications. So again, with those older plans, you're seeing drugs get knocked off the formulary, get moved up to higher tiers. What we're seeing with the newer plans are things that may have been in a higher tier last year are being dropped down. Drugs that were on tier 3 or 4 may be on tier 1 or 2 with the newer plans. So even if you think that, hey, I want to keep my carrier, I don't want to switch plans, it still is worthwhile to take a look at the newer plans because a lot of times you're going to get better prescription coverage by doing that. Which takes us to number 4, stronger provider networks. Now, this one was always a little weird to me, and the reason for that is if you're with the same carrier, I always just thought, hey, they're going to cover the doctors the same no matter what plan you're on, but that is not true. With some of the older plans, they're just removing doctors from that particular network, but the doctor will still see you if you're in another plan with the exact same carrier. So if nothing else, just go ahead and check with your doctor and check with the plan to make sure that your doctor is going to be covered going into 2026. Because the last thing that you want to do is go to the doctor, think that you're covered, and then get a bill later on for that, when all that's really needed is just to do a little bit of checking. Now, the best move, if there is a new plan in the area, is to see how that doctor is covered, because not only are the networks going to be a little bit better going into 2026, so there may be even more doctors that you have access to, but the cost of those doctors are going to be considerably less as well. And that leads us directly into number 5, which is lower overall costs. We're seeing some plans out there with annual maximums as low as $2,000, meaning that the most that you'll pay out of pocket for your medical services in 1 year is going to be $2,000. A lot of $0 copays for the primary care physicians, 10, sometimes even $5 for a specialist. There's some really awesome plans out there, and you just have to take a look. But what it does is it reduces the overall cost for you per year. So even if you're healthy now, it still makes a lot of sense, because you never know when you might get hit with something like cancer, heart attack, stroke, might have an accident, fall down, car accidents. There's a lot of things that could happen. Your health could dramatically take a dive out of nowhere. And the last thing that you would want is to pay extra money just because you didn't want to take a few minutes to check. So now, what's the key to winning? The number one thing is don't do it alone. Now, I know it can be tempting. There's a lot of access online and you can look up a lot of tools, but it's really a good idea to get with a broker. The reason why is because we can look at everything side by side and we can weigh the pros and cons and put it in a way that's easy to understand, because sometimes some of these websites are intentionally confusing and they don't tell the whole story, but we know where to look to make sure that everything is covered the way that they say it is. Not everybody wants to read through an entire summary of benefits, but that's our job, to make sure that you are able to get the most out of your plan. So by making sure that you get with someone, you're not only able to make sure that you keep your doctors, you're able to maximize your benefits, lower your costs, and make sure that you're not spending any additional money going into 2026 that you normally wouldn't have to spend. And the best part is using a licensed broker doesn't cost you a penny. So you get to maximize your benefits, reduce your headache, and it doesn't cost you a thing. So look, I get it. Nobody really wants to go through the hassle of changing their plan from year to year. It can be overwhelming. There's a lot of paperwork, a lot of things that you have to look out for, but working with a licensed broker makes that whole process easier. And the last thing that you want to do is go into 2026 with the same old plan, but with worse benefits that you had going into 2025. And really all it takes to get there is having a little clarity on what's available, having the confidence to know that you are on a plan that's going to be a good fit for you going into 2026, and make sure that you have the coverage in place that's a good fit for you. So if this helped, like it, share it, subscribe. It really does help the channel and get that information out there. But above all, do not let the deadline come and go and still be stuck on the same plan that you were with 2025 when there could be a better plan out there. You only have until December 7th to make the change, and I'm going to leave a link in the comment section below that you can click on to schedule a time to speak with me one-on-one. Should take about 15 to 30 minutes depending on your doctors and prescriptions, but we really just want to make sure that you're maximizing your benefits going into 2026. Take a few minutes. It could save you a lot going into next year.